Hello, I'm Dr. Petros Grivas. I'm a professor at the University of Hudson and Fred Hudson Cancer Center. And I'm very, very excited to welcome the first guest I have here today, talking about, life and science and oncology and Fred Hudson Cancer Center. So it's my distinct honor and pleasure to welcome my dear friend and colleague, Dr. Cristina Rodriguez, who's a professor here at the Department of Medicine, Division of Hematology Oncology, and at UW, and also at the Clinical Research Division at Fred Hudson Cancer Center. Tina, welcome on board.
Petros, thank you so much for having me and for thinking about me for this podcast. It's really an exciting time, in oncology and head and neck cancer, and I can't wait to talk about it with you.
Absolutely. You have done so much work in the field. And, I was thinking about this podcast and how we can have an impact globally, right, with the work we're doing. So, Tina, let's start. I want to hear more about you and your story. Both you and me, come from different areas of the world. Tell me briefly about your journey. How did you end up here at Fair Hats?
Well, I too come from an archipelago, not Greece, but the Philippines. I grew up there, was raised there. I had a I have a big extended family. A lot of them are physicians. In fact, my uncle, my godfather, was an ENT trained physician in rural Mindanao, which is the southernmost island in the Philippines. I'd get sent there every summer. We didn't have summer camps in the Philippines. I'd get sent there. I would help out in the clinic, and it really made me believe that I had a future in medicine. I enjoyed it very much. I liked, the science aspect of it, but I also loved the human aspect of it, and just being able to touch people's lives that way. After I got to medical school, and I finished when I graduated, I decided to look out for residency opportunities outside the Philippines. And I ended up in a place where you and I have in common. I ended up at Cleveland Clinic. At Cleveland Clinic, I met my mentor, Dave Adelstein, who back then was a very senior head and neck medical oncologist, was the co-chair of the NIH Steering Committee for Head and Neck Cancer. And it was really through him that I had an appreciation of patients with head and neck cancer, the struggles that they go through, the little interventions that we can have in clinic that could make a big difference in people's lives. And I decided to go down that field and I never looked back. I ended up, I thought I would go back to the Philippines, but I met my husband at Cleveland Clinic, who is also a Fred Hutch medical oncologist. And he and I both decided that, when the time came for us to have families, to move closer to his family and mine. So here we are out on the West Coast, and this wonderful opportunity to work here at Fred Hutch came about. And we've been here 13 years. And, we love the institution and the city, and we're really having a great time raising our family here.
That sounds amazing, Tina. And, I have to tell the audience, I knew about you and your amazing husband, Steven Smith, before I came here because I was like living a clinic, right? And I was doing, work there, and everybody was telling me, you go to Fred Hutch, you have to meet Tina and Steve. They're great people. And they were absolutely right. So I know you and Stevie were the first people I met when I came here. One of the first
Right. I
people.
remember that. Well, you seem to know more about Greek restaurants in Seattle, so I have to give you credit for expanding my culinary knowledge of Seattle restaurants. You ever need a Seattle restaurant, Greek restaurant recommendation? Petros is the one.
Absolutely. And we know, of course, we do the big, amazing ASCO Greek dinner on every Monday at ASCO every year. So, Tina, you're always invited, my friend. And I think, you on your end, I think you and Steve gave me a very beautiful map with all the tracks and trails here in Seattle. I have to do a better job, leaving my laptop and go out in those trails, but you helped me with that.
Yes, good. I'm glad that's a good welcome present for people new to Seattle.
Absolutely. And you mentioned David Adelstein there and as your mentor, and you have done so much work, Tina, in the field of head and neck cancer, medical oncology, and working with an amazing team here. Can you tell us a little bit about what is happening in the field of head and
Sure.
neck cancers? It's so diverse in terms of the tumor types, and I want to hear from you as a leading expert in the field.
Wow. Great question. But I think first of all, I want to say that what attracted me to head and neck cancer are a few things. Number one, the multidisciplinary aspect of care for head and neck cancer is really critical. I love being part of the multi-D team. It's such a collegial team of surgeons, of radiation oncologists, of medical oncologists, and not just that, outside the doctors, the specialists that help us care for patients, the speech and swallowing therapists, the nutritionists, the social workers, the psychiatrists. We're a village really that are committed to making sure that patients go through treatment seamlessly and really trying to do our best to make it as easy on them as possible and to have the best quality of life possible. So being in a multidisciplinary team to me is very refreshing because I learn a lot from all of the specialties that help care for patients. And it's really an extremely dedicated group of people. You will not find unengaged members in our team. I can tell you that people are drawn to this field because they're really passionate about it. So that's one of the things. I think it's really critical when patients come through the door that they get the benefit of the expertise of all of these specialists that look after patients. The second thing that I love about doing head and neck cancer here at Fred Hutch is our ability to not only care for patients with the cutting edge tools such as our proton center, our neutron radiation, our transoral robotic surgeons. It's really our ability to carry out clinical trials. So clinical trials, what Dave Adelstein taught me ages ago, is that it's the way that we try to answer questions that we have in day-to-day practice. It's the way that we move the needle forward. It's the way that we make things better for patients. So, we are committed as a multidisciplinary team to advancing care, making our patients' lives better, and we do that through clinical trials. We have a large portfolio of clinical trials that really extends that really studies new treatments for patients who are just starting treatment or patients whose cancers have come back, even patients who are going through treatments that have high side effects. We have um, clinical trials that look at how to mitigate or lessen some of those side effects when going through treatment. It's been an incredibly gratifying journey for us. In fact, this is also to discuss that very recently there has been a big change in how we treat patients who are undergoing surgery for head and neck cancer, which incorporates the use of the immune checkpoint inhibitor called pembrolizumab into treatment. We had opened this trial, I don't know, 3 or 4 years ago, enrolled a bunch of patients on it, and this trial really led to the approval of the use of pembrolizumab in before and after surgery in patients. So, as a team, we're very proud of that effort, that we're part of that the team that got this trial off the ground, and that we were able to offer most cutting edge treatment that is now at standard of care to patients 3 or 4 years ago. So I find that is a really important mission that we have as a team, and that as a multidisciplinary team, all of us are really on board with that mission. And finally, I think a third thing that I really that really captured my desire to treat head and neck cancer is the fact that there's a lot that we can do as a society for head and neck cancer. It is a disease of exposure, so traditionally head and neck cancer was a disease that was associated with a lot of alcohol or tobacco use. And recently there's very solid evidence that high risk HPV causes certain types of head and neck cancer. These types of exposures, we as a society can create public health efforts that we have proven to be successful in curbing the incidence of this cancer. For example, smoking related head and neck cancer is pretty uncommon today because as a society, we have effected public policies that educate the public about the harms of smoking and limit access to tobacco. So in the same way that we have a lot of programs to encourage patients or encourage parents to vaccinate their young kids against HPV. I think these types of programs are really going to make a difference from a prevention side and hopefully lessen the burden of these cancers in the future. Was
So
that?
well said. Amazing. You covered so many topics, Tina, so eloquently and very efficiently. And you read my mind. These are questions I had for you, and the impact that we can have with prevention, as you mentioned. Tell us a little bit more. I think the audience, there are many patients, patient advocacy groups out there listening to us. HPV, right? The high risk HPV traditionally has been linked, of course, with cervical cancer, which is true, but there are many other cancers, as you mentioned, anal canal and head and neck cancers that can be related to HPV. And tell us a little bit more about, how is the vaccination going? I know it's for both boys and girls, right? At certain age. And I think you can even get it later in life, right?
Yes, you can. So I have to make sure that I don't, I get carried away talking about these things. So you tell me if I'm taking up too much time. Um, the story about HPV and the demographics of head and neck cancer is so incredibly interesting to me. HPV is a very, very common malignancy. As you know, 90% of human beings are going to be infected with this virus at some point in their life. But the most common age of infection is somewhere around the age of 17 in this society. Why is that? It's because the virus is transmitted through bodily fluids, and in this society, that late teen age is when patients first become sexually active. We know about what HPV can do to us from the results of from the work of this Nobel laureate Harold Zurhausen, who has a wonderful, who has uh, done elegant studies showing us showing us the link between HPV and cancer. So what we know is that when you're infected with HPV, there's a very wide number. There's about more than 100, I think, subtypes of HPV, but there are a few select subtypes that have the capability of transferring some of their genetic material into the lining that they infect. And even though our immune systems get rid of these viruses, they're overall mostly harmless. Over time, that transfer of genetic material can lead to the development of cancer in that area. And that time frame is usually a very long time frame. It's usually measured in decades, which is why, for example, the more well-known HPV cancer, cervical cancer, which it's really a cancer that leads to early detection and screening because of that lead time. Now, what we know about that, we're not as savvy with head and neck or oropharynx cancers yet. Not, we're kind of lagging behind our gynecologic oncology colleagues. But there's a few things I think that that we've learned as looking at the experience with cervical cancer. Number one, the head and neck cancers that are associated with HPV are in the oropharynx, which is the base of our tongue, that part of your tongue that you don't see when you look in the mirror, and your tonsil. And the interesting thing about this part of our body is that it's very thinly, the lining is very thinly keratinized. The virus really likes that. In fact, this lining, they specialists say, is very similar to that part of the cervix in women that are very thinly keratinized. And it's an area that's very easy for the virus to infect, and where the virus can transfer its genetic material to the cell, the epithelial cells. What we know, we don't know how to screen for oropharynx cancer. That the cervix and the oropharynx are very different, like areas of real estate within the body. These can be really, there's a lot of individuals working on this front, but we don't know how to screen for it. So most of the patients who are diagnosed with oropharynx cancer that are HPV related tend to present because they noticed a lymph node in their neck. The population that gets these types of cancers are generally younger individuals, like in their 50s or 60s. They tend to be white males for reasons that we don't understand. They tend to not be smokers. They don't tend to have a lot of alcohol in their lifestyle. But the really key thing that we've also that we've observed in recognizing this HPV related subset of patients is that these patients have an excellent prognosis. These are patients who can be treated and cured successfully the overwhelming majority of the time. So when we see patients like this who have HPV positive cancer, we educate them about its relationship to high risk HPV. Usually, if these are younger patients with young children, I always talk to them about, hey, it's really important to think about prevention in eligible members of your family. And I always tell them that, look, this is a very curable cancer, but apart from offering you treatments that have the best chance of cure, the other major priority that we have is to ensure that your quality of life remains excellent. And that's really where kind of I circle back to the multi-D team and and we, among ourselves and among our specialists, we talk to patients about how best to approach this so that you not only get cured of your cancer, but you get to live out the rest of your life enjoying food, enjoying Greek food, talking, singing, all of the pleasurable things associated with life. We want to make sure that those are maintained in our patient population.
So important for sure. And thank you, Tina, for telling us all those important information. And I think for the community out there, again, vaccinations as primary prevention very important for HPV and some other cancers too, like hepatitis B, for example, in terms
Right.
of viruses. And the point you make, Tina, is very important about both escalation when needed and de-escalation of therapy is important, especially when you have excellent outcomes. Can you give us a few examples, Tina, of some clinical trials that are looking at the de-escalation? And I know you're involved in many trials in head and neck cancers.
Yeah. So, I will harken back to one of the major de-escalation trials that we worked on. I have to always remember a wonderful colleague of mine who was part of hiring me and convincing me to come here, Eduardo Mendez. He was a wonderful head and neck surgeon and physician scientist who was just an incredible colleague. Unfortunately, he passed 8 years ago now. But when he came here, this was his passion. This was the time when new surgical techniques had been developed for oropharynx cancer using this cutting edge robot called the Vinci robot. We call it transoral robotic surgery. And one of the major scientific questions in treating oropharynx cancer was whether we could use this robot to remove the cancer as minimally invasively as possible, and then look at the cancer under the microscope and decide which among these patients should get less treatment after surgery. That was a large trial called ECOG 3311. We opened that trial, we put a lot of patients on that trial, and it really led to a new standard in looking at patients after surgery and thinking about removing chemotherapy for patients who don't need it, and even reducing the dose of radiation that they might need after surgery. So, it unfortunately Eddie did not see that paper published, but he was part of, he was an author on that trial. But I'm sure he would have been very proud that all of his hard work like really led to a big impact in how we treat patients nowadays. Um, so yeah, I remember Eddie a lot. I miss him, and I don't know. Did you meet him, Petros, when you came here?
I knew of Eddie and I have heard great things about him from you and many others, Tina. Sadly, I never had the chance to meet him in person, but his work is so motivational,
Mm-mm.
so inspiring. And, everything you are saying now definitely, reminds me of all the amazing things I heard. And I know there is a symposium in his memory
Right.
and an award, right?
Yeah. So I think when Eddie died, all of us were really wanting to make sure that when he died, he always, I remember him always texting me saying, "Hey, continue this. This is important." We really wanted to honor his legacy. And one of the ways that that's been done by the Fred Hutch is to have an Eddie Mendez Research Award. It really focuses on people like Eddie, underrepresented individuals in science. And so it's been ongoing now for many years, and it's it's just been. I feel like every time I see it, and every time I see that symposium, I feel like Eddie would have been proud that his legacy and his works being carried out here at Fred Hutch. It's been great.
Absolutely. And I totally hear you, Tina. And I think all of you and the Ferhat's family came together to keep his legacy alive. And I think all the work you're talking about is inspired by work Eddie did. Tina, tell me, patients are out there, colleagues in community are out there, and we love to partner with our colleagues in community. I admire them for being able to see so many different patients with different cancer types. Tell us a little bit how you interact with colleagues in community, and how do you handle when patients being referred to you? How do you work with the colleagues in the community practice?
Right. So for head and neck cancer is a pretty unique cancer because most patients are diagnosed with cancer that is localized either to the head and neck or lymph nodes in the neck and don't have disease spread elsewhere. That's kind of how most of the patients present. So a lot of these patients are really candidates for curative intent therapy. But when you talk about curative intent therapy for head and neck, there's various options, and you really need the opinion of a surgeon, a head and neck surgeon, a radiation oncologist, a medical oncologist. You kind of want the speech pathologist to work with the patient. So what we've done as a group is to try to streamline that process, which can be difficult for people out in the community. Like, how am I going to organize all of these things? So we have two multidisciplinary clinics here at Fred Hutch. They're on Wednesdays and Thursdays, where all the specialists, including the nutritionists, social worker, speech and language therapists, are present. Where we come in, bring the patient in, and evaluate them all in one go. So this really lends to like it avoids having all of those multiple trips back and forth and having talk amongst you have to communicate among each other about what is the plan. This way, when we see everybody together, we can come up with a plan together and present that to the patient on the same day and get things started right away. So our hopes with doing that is to really streamline all of these visits that are needed and streamline coming up with a solid plan for that patient. So far, we've been pretty successful. We've been quite busy, and we're really working to make sure that there's ease of access into our clinic so that people won't have to feel like they're waiting as long. We're busy and we're growing as a team, which I'm really happy about. There's a brand new medical oncologist working with me named Lauren. She was an amazing doctor, incredible researcher, and just an all-around wonderful person. Not to mention all of the other members of our multidisciplinary team. So that's kind of what we're working on, and it's been great so far. A lot of fun.
Absolutely. And I agree with you. All the team members are fantastic. And I think the strength of this program, it's, as you said, the totality of the expertise and the synergism among the expertise, surgery, radiation oncology, medical oncology, nutrition and social work and speech therapists and so on and so forth, genetics, so on. And I think it reminds me of the quote, like the strength of the wolf is in the pack, the
Right?
teamwork, right? And thank you, Tina, for doing such a amazing work with this team and helping patients. I always say we wish there was no cancer there, right? And we do only prevention, but there's so much need. So thank you for working hard to meet the need, and also to your point, getting access, working with getting
Yeah.
people in as quickly as possible.
Totally. No, it's why I get up in the morning every day, and it's just a wonderful group to work with. I wanted to make sure that the audience was aware that we do these periodic webinars with the head and neck team just so we can reach our referral partners and our community doctors and see what their needs are and how we can help them, and also make them be aware of what trials are available to their patients. So yeah, it's a good time to be here at Fred Hutch and working on growing our head and neck cancer program. I'm really excited.
For sure, it's exciting time in oncology. The progress being made, more lives are being saved with research, and Fred Hutch is in the forefront, as you said, with UW and Fred Hutch partnership. And to your point, Tina, about trials, I know we're working on a phone app application. I
Mhm.
want to
Yes.
share that with you. I know you're aware, and the audience here, that hopefully very, very soon we may be able to share this phone app with our colleagues and friends in the community practices, so they can see very quickly which trials may be
Right.
applicable to
Right.
your patient, my patient. So we're excited about bridging the gap, and work together with community oncologists. Tina, I can tell you, I can talk to you for hours, and I'm always learning from you. I want to thank you for spending the time today doing this first podcast. Many more to come. You gave us a very high bar to follow, and looking forward to inviting you back in the future.
Of course. Thank you for having me, and the best of luck with the podcast. I'm really excited, and I wish you the best. Thank you for having me.
Thank you so much, Tina. Thanks to the audience listening to the first podcast, Meet the Greek, and many more to come. Thank you. Have a wonderful day. Thanks for all you're doing.
Thank you.